We are launching today the European Diploma for Spain nurses, so it's a core curriculum for that European Diploma, and there hasn't been a standard across Europe for competencies and education for pain specialist nurses before. So this is very new, very exciting, and nurses across Europe have quite a lot of variations in their education. Some countries are very well structured and have educational programs for specialist nurses. Others there isn't any at all. And so this is about the competencies that we feel are important across nursing and across Europe that will help nurses in their professional development and ultimately benefit patients and their families around pain management. So patient voice and patient experience is incredibly important, and we have structured the curriculum to think about all of the key areas that are important to patients around communication, around what competencies that they feel are important for their health professional, and we are looking towards engaging patients in the next exciting stage, which is just developing an exam and co-producing the next stage of the core curriculum, which will also involve an organisation that have endorsed our curriculum called the European Specialist Nurses Organisation. So they're a body who have been established since 2006, who are around strengthening the voice and again working hard to benefit patients across Europe by recognising the impact and the importance of the role of the specialist nurse in whatever field. Well, healthcare professionals potentially have a number of biases because their education that prepares them for their qualification, their healthcare qualification, whether it's a nurse, whether it's a doctor, physio, pharmacist. We have done a number of surveys which have shown that the education that they receive within their training is very limited. So pre-existing attitudes which have been shaped through their life and their experiences may not be challenged. And then they also may not have the skills, they may have got a chance to rehearse the skills around pain assessment, pain management, and develop those competencies. So they first of all have been shaped. What's exciting about the curriculum is recognising the role that specialist nurses have in supporting other healthcare professionals who may have had that experience. So specialist nurses have a clear role. We have a section purely on patient education, purely on education for healthcare professionals in this curriculum, which recognises the role that specialist nurses have in supporting patients, their family, supporting healthcare professionals and educating other healthcare professionals so that we can challenge some of those stigmas and those attitudes so that patients are not labelled and not stigmatised.